All right. Hi, my name is Megan. I'm going to be your nurse today. Doctor has ordered me to do a full head-to-toe assessment on you. Is that okay?
Perfect.
Perfect. I'm going to provide some privacy. Can you confirm your name and date of birth, please?
Xavier, April 25th, 1988.
Perfect. Thank you so much. And do you know where you are?
In my kitchen.
Perfect. Do you know today's date?
February 29th, 2024.
Thank you. And do you know who the president is?
Biden.
Perfect. Patient appears to be conscious and oriented ×4. No physical deformities. They are appropriately groomed and dressed. Skin color appears to be even and appropriate for their ethnicity. Patient appears to be alert. No apparent speech, hearing, or vision concerns. We're going to inspect the scalp. Scalp doesn't appear to have any lesions. They're free of lesions. Temperature, we'll check the temperature. Temperature is warm and dry. We would check for skin turgor. We'd check on the collarbone. We'd pinch it. If there is any tenting, client would be dehydrated. They are not. Have you noticed any rashes?
No.
Perfect. And then also wanted to discuss the brain and risk assessment. This is to check for any potential pressure ulcers to determine your risk. There's multiple categories that it's rated on, but 3 of those categories are going to be moisture, activity, and mobility. Then we'll move on to your head. Head is symmetrical and normal. Have you noticed any facial drooping?
No.
Okay. Your ears. Move on to your ears, which are you having any ringing in your ears?
No.
Okay. Ears appear to be symmetrical. And then we would do a hearing assessment, which you'd stand about arm's length away from the client. You would say a combination of 3 letters and or numbers. They would repeat it back to you. Alrighty, and then we have your nose. Are you noticing any nasal drainage?
No.
Okay. We would check for patency, so you would place your finger and inhale. Nostrils appear to be patent. Shape appears to be appropriate. Then we would move on to the mouth and throat. So we get this out. Get open. Oral mucosa appears to be pink and moist. No apparent dental decay. Are you having any difficulty swallowing?
No.
Okay. And then can you swallow for me? Perfect. Trachea appears to be midline. Have you noticed any cough or mucus?
No.
Okay. Perfect. And then we move on to the eyes. Eyes appear to be, the pupils appear to be equal and round. They are about 4 millimeters. We check for light reactivity. You just look straight ahead. Pupils are reactive. And then you just look at the pen and follow it in. They are accommodating. Now, have you had any headaches recently?
No.
Okay. And then we want to discuss the Glasgow Coma score. This is a baseline to rate for your level of consciousness. It is rated on a scale from 3 to 15. 15 is the best and highest where you want to be. There's 3 categories. It's going to be eyes, motor, and verbal. And then we would move on to respiratory. Are you having any difficulty breathing?
No.
Okay. And regarding your eyes, are you having any blurred vision?
No.
Okay, perfect. So moving on, we will listen to his lung sounds. You just take deep breaths. So right upper, left lower, right middle. And we'll move on to the side, right lower, left lower. And move on to the back. We have the left upper, right upper, right middle, left lower. Perfect. And then we also have some techniques that we need to discuss. So in the event you have a surgery, you're not able to mobilize like you should, we have the turn, cough, and deep breathe. So you inhale, hold deep, turn your head and cough. And we also have the incentive spirometer. This also helps remove any mucus buildup to prevent you from getting pneumonia. So you'll put this in your mouth, inhale real deep, and exhale. This, we like you to do this about 10 times every hour. Okay, and then we will move on to your cardiac assessment. Are you having any chest pain?
No.
Okay, we'll go ahead and listen to your heart sounds. We have aortic, pulmonic, you can breathe normal, herbs, mitral, or tricuspid rather, and mitral. And these assessments would be done under clothing, but for the sake of this recording, we're just going to do it above. And then I would turn to the bell of the stethoscope and also listen for S3 and S4 sounds, and also any murmurs. Okay, then we check pulses. We would check your radial pulse. Bilaterally, you are +2. We listen to posterior tibial, +2 on both sides, and then dorsalis pedis, they are +2 on both sides. We also have other pulses, which would be your carotid, axillary, brachial, femoral would be at the top of the thigh, and behind the knee, popliteal. And then we're going to check for capillary reflex. We'll check your fingers. Perfect. Check the other side. You are less than 3 seconds. We'll check for edema. No edema on the upper extremities or the lower. Awesome. And then we would move on to gastro. So we would lift up the shirt initially, looking for any discolorations in the skin, any distension. Then we would listen to the bowel sounds, where you'll start in the right lower quadrant. Right upper, left lower. Then I would turn to the bell and listen for any potential bruise, which would be aortic, renal, and iliac. And then I would palpate the 4 quadrants. Perfect. Are you having any issues with constipation?
Nope.
When was your last bowel movement?
Today.
Perfect. Are you having passing gas normally?
Yes.
Perfect. And are you having any difficulty urinating?
No.
Okay. And then we would move on to the musculoskeletal. So we would check bilaterally. Are you having any joint pain anywhere? Okay. Perfect. We would check the elbows. So I would have my non-dominant hand on the joint. You would flex towards your shoulder and then extend out. I'm checking for crepitus. And then you're going to pull and push. And then we will do your other arm. You're going to flex and extend. Go ahead and pull and push. And grade that on a 5. We'll go ahead and do your wrist as well. We can do this at the same time. So we'll go ahead and flex and extend and pull and push. Perfect. Grade 5 there as well. And then we'll check the knees. Those knees are currently in the flex position. We'll go ahead and have them extend and bring it down. And go ahead and extend, bring it down, and push and pull, push, and pull, straight as grade 5. And then we're gonna check the ankles. So we're gonna do point toes towards the ground. That's gonna be plantar flexion towards toes towards the sky. It's gonna be dorsal flexion, so we're good. Checking for crepitus there, and then you're gonna pull, go down and up. Very good. Alrighty, and then we would have you stand up. Now I would have them check their gait, so I'd have them walk on their tippy toes or do toe to toe to check that, but we're not doing that due to limited space. And then we're gonna check for your balance. So you have your arms to your side, and you close your eyes. Have them stand there for about 5 seconds, and client has minimal swing, and you are good.